Hi, I'm Peter Homa, and I have the privilege of serving as the Director General of Defence Medical Services. And I'm delighted to be able to join you and to offer experiences from the road on the path I've taken, where, as you'll see, I'll share some of the scar tissue which I've acquired valuably over time, mostly from my mistakes. The coordinates of my offering, I'll say a little bit about my own leadership path, and then offer some leadership lessons offered with humility and collegiate support. If you will, handing across a baton that I've been able to develop over the past nearly 40 years in management and leadership to your good selves, in order that I hope they will in some way help you. And then my offering of my Desert Island Reads, some of the publications that have helped inspire and on occasion sustain me during the darker moments of my career and sometimes personal life. A little bit about my background. I've been the Director General of the Defence Medical Services since August 2019, a wonderful organisation comprising a fantastic group of people, including yourselves, with a really important mission. Prior to that, I'd had some 37 years experience in the National Health Service, 27 as a chief executive in 5 different organisations, a couple of national organisations, including an earlier incarnation of the Care Quality Commission, was described as the Commission for Health Improvement. And most of my experience in terms of hospital work has been in university teaching hospitals. I had the good fortune of being selected to support Sir Robert Francis as an advisor in the Mid-Staffs report, and learnt a huge amount from that, where in essence good people did bad things in a toxic culture and system. And the testimony that patients and staff gave, and indeed the loved ones of both patients and staff, is testimony that I think few will ever forget who had the privileged position to listen to it firsthand. And generally, when looking back, as well as looking forwards, I've come to realize, as Soren Kierkegaard observed, we live life forwards and understand it backwards. I should also mention I've introduced a few quotations during the course of our time together to rescue you perhaps from the land of Morpheus, but to make you smile and perhaps to give you another angle on some thinking. So Buffalo Springfield, that well-known philosopher, said, "There's something happening here. What it is ain't exactly clear." And many of us, as we embark upon our leadership journey at whatever point, may feel like that. We're not clear what direction we're going in, perhaps in a professional sense, perhaps in a personal sense, or perhaps in both. It's good to be reminded of where we've come from. So this photograph with the chap the top left with the rather affectatious beard is me. And this is the National Management Training Scheme graduate intake in 1981. Sadly, 3 of our number there have died. One individual has become blind, and notwithstanding that, has published 2 books with great effect. And only 2 people are still working in the NHS. And what is nice is we still remain mates, as I'm sure you do, amongst training cohorts that you've been part of. But if at that stage in 1981 you asked any one of us to map out a lifeline of what would happen, few of us would have got anywhere close to what actually happened. And here's my lifeline. I won't go into detail in this, other than to perhaps invite you to give some thought to, if you haven't already, mapping out the key events, the key people, perhaps the key decisions that you took that have brought you to where you are. And my wife and I did this in our joint personal lives, and we also extended it from present over the next 10, 15 years. What are the sorts of things that we want to do together? The place we want to visit, the projects we want to take forward, the family and friends that we want to ensure we're investing time with. This is all, of course, pre-COVID, and it proved to be a really helpful conversation. So I invite you to do the same. And I won't go into details in any of these, other than to make the observation: in life, there are many gifts. If we're lucky, we have good health, and indeed, your calling is to help sustain and develop the health and well-being of those we serve. So a gift in life is good health, loving relationships, and great teachers. And when I sat down to map out the key influences on my life, great teachers, those individuals who have the gift of inspiring and educating in the broadest sense of the word, including my mum and dad, have had a very, very strong impact. And I realised I was very fortunate and have been very fortunate in continuing to benefit from great teachers, including in my case, reverse mentorship, where I've learned a huge amount from two friends and colleagues. So the next sort of continuation of the Lifeline up until 2006, when I became Chief Executive of Nottingham University Hospital. It's a fantastic job that I enjoyed for 12 years before becoming the chair of the NHS Leadership Academy, and then onwards to Defence Medical Services. And if you see, Ben and Charlotte would have born my son and daughter during this time. And if I can pick out one episode, and that's in 1989, I joined the Leicester Royal Infirmary, a classic city centre university teaching hospital, as the deputy general manager, deputy chief executive, if you will. A big step up for me, and within a few months of me joining the organisation, my boss was sacked. And the reason he was sacked is because he spoke truth to power without grace. I suddenly found myself catapulted into the acting role of the chief executive of, in those days, a very large university teaching hospital that was strategically out of whack in performance terms, insofar it was measured in those days, which was mostly to do with money and waiting times. It was out of whack, and there was a very strong gap between clinical colleagues and management colleagues, and I didn't know what I was doing, I confess. And the first 2 years in that role, and I subsequently applied and became appointed, were, I think, the most stressful of my entire life in a work sense. And I often look back on that period and think, well, this is what it must be like when a nurse becomes the ward manager, a GP becomes responsible for his or her own population, patient group, or principal perhaps, or a consultant becomes a consultant, or a scientist, an allied health professional. But when you arrive at a point where you have a very clear set of responsibilities, accountabilities, and expectations. And I'm very sensitive to that and mindful of those who move into leadership positions for the first time. But I invite you to give some thought to your own lifeline, best done with your partner, friend, and in my wife and in my case, with a bottle of wine. The most important things in this life aren't things. I leave that to you. Certainly, experience has taught me, and during COVID, I think we've had reinforced the most important things: relationships. So, the letter to myself. This is something I wrote when I was 60, when I tried to gather together, mostly from things that I hadn't done well. What are the key lessons that I'd like to have been able to assimilate and apply when much younger, in the hope that I might be able to offer those to others? As I say, it's in the spirit of humility and real collegiate support, because the path in looking after patients and caring for patients and after staff is a huge privilege, and can be hugely challenging. And we'll come to that. So the base note here is you can't lead others until you can lead yourself. And what I've learned from a variety of settings, including when with Dame Deirdre Hine, previously the Chief Medical Officer in Wales and the Chair of the Commission for Health Improvement, starting up a new organisation with literally just two of us as the employees, and we then grew that to an organisation of several hundred, is the importance of values. The value of values. Be clear about your values. I've actually gone to actually set them out, writing them out, and I make sure that when I join an organisation, there's a correspondence between our respective values. And the Norwegians have a phrase: "Nobody needs a good captain on calm seas." And the same is true of the application of values. It's when we're facing really challenging times with deep ambiguity, perhaps certainly deep challenge, maybe fear, and then drawing upon one's values to act as a satellite navigation system, a lodestone, if you will, is enormously helpful. And if one conducts oneself in a manner consonant with one's values, then you will not disappoint and you will not be disappointed. So I leave that that thought. And then the whole business of leadership development. Dame Deirdre said to me at one stage when going through my appraisal, Peter, work should be like a lifelong seminar. And I really like that sentiment, particularly when going into very challenging circumstances. And just developing that, I think the notion of leadership development, such as we're interested in today and now, is learning to be oneself more skillfully, to understand one's strengths, one's weaknesses, the situations in which one flourishes, and those in which one doesn't. And what I've certainly learned is the hugely powerful difference that diverse in every sense, in terms of ethnic origin, the cognitive approach, different perspectives bring to high-performing teams. And I would really want to encourage you to make sure that wherever you are in terms of work, you ensure it's as diverse as possible to get the fantastic high-octane environment that brings in terms of achieving results for those that we serve. And what I've also learned is we are more constrained by ourselves than others. If we believe that we can't do something, then we won't. If we believe we can, then there's a very good chance that we'll accomplish whatever it is that we need to. And I would strongly recommend that you gain, if you haven't already, mastery in quality improvement. There's significant evidence around healthcare across the world of the application of classic quality improvement methodology. The Institute of Healthcare Improvement in the States is probably the global thought leader of this, and check out ihi.gov for their website for a fantastic repository of tools, techniques, and case studies. And the NHS has growing expertise in this area too. And it leads us to the observation that the question is not if the opportunities for improvement exist, but if we choose to take them. And when looking at a service, a clinical service, or indeed any other service, I think a very helpful perspective question is, if this service didn't exist, how would we create it? And I've never, even though I've been involved in many hundreds of improvement projects, I've never come up with a situation where what we've got is perfect. Mostly it's the product of accretion, institutional convenience, and tradition. But actually creating the time and space and to enable the application of skilled quality improvement methodology, and drawing on the lived experience of patients, of staff, and others to improve what we do is a wonderfully liberating experience that ultimately improves what we do for patients and the environment in which staff are asked to do it. The next is time and energy management. And I particularly like the notion of energy management. And I've learned over the years that keeping fit is really important, and I need to invest time in doing that. Also, I've learned the leading indicators of when I'm becoming knackered. That they include for me in this sequence. I don't read as much. I enjoy reading, but when I'm tired, I don't read as much. I start to eat chocolate. Then I start to move into to donuts, and then in order to help me sleep, I then drink red wine. And I'm very mindful of that sort of escalating process. So learning what it is that optimizes your energy to help sustain you for the marathon ahead is really important. W.H. Auden, we are here on earth to do good to others. What the others are here for, I don't know. Unusually humorous for Auden, but I hope it makes you smile. And then the notion of, and I won't go into each of these bullet points, but looking after others in terms of their career, providing them with support, not just during the time that one's working with other colleagues, but across the arc of their working life. The next is drawn from Stephen Covey, the author of 7 Habits of Highly Effective People. Sadly, Covey's no longer with us, but if we have the benefit of his thinking and writing, and his notion of let me seek to understand before seeking to be understood. And there's no substitute in my experience, largely through my mistakes, if possible, actually going to see what it is that one's got to solve, to talk to people in order to better understand the situation, as opposed to just relying on reports and data. But the lived experience of those that are dealing with whatever the challenge is a very important testimony if one's able to access it. And there's a huge amount of talk, the final bullet points here, on organizational transformation. I'm a big supporter of thoughtful, ambitious, in the best sense of having bold, audacious goals in pursuit of serving others. But in order for true transformation to occur on a sustainable basis, we need to encourage those who work within our organization in order to feel renewed hope, a renewed sense of optimism, of possibility, of vision. And without that, it's unlikely that transformational efforts will be successful. And then something that I learnt when I was in Nottingham: avoid short-term answers to long-term questions. And a brief example of here is about 15 or so years ago, John Reid, then Secretary of State for Health, came out with the bold ambition that seemed to me at the time completely unrealistic. He was right, I was wrong, and that is eliminating MRSA bacteremia from hospitals and indeed other healthcare settings, mental health services, primary care settings, and so on and so forth. But the biggest burden in terms of the incidence was in acute hospitals. Long story short, the government issued some money proportionate to the size of organisation in order to deep clean in hospitals areas wards. And there was a natural experiment that formed itself. There were, crudely speaking, 2 groups that formed, self-selected. There was one group of hospitals that pursued the deep cleaning to get the wards done as quickly as possible, because the performance metric was the number of wards cleaned. Not how well they were cleaned, but the number of wards cleaned. And then another group formed where Nottingham was part of this. We said, this is a hugely important opportunity. Let's do the job really properly. So we closed wards, and that was when it was possible to close wards, which is increasingly difficult. We hydroperoxide bombed, as it's called, the wards. We took the grills off, the ducting and the ceilings, cleaned 3 meters back. We changed the curtains and replaced them with silver curtains with silver with antimicrobial properties. And we did the very best job that we could. But of course, we took much longer. So the cohort of hospitals that took longer were on the naughty step as far as the top of the office were concerned, and received appropriate chastisement, and we argued on the basis that we were doing a sustainable job. And then what happened over the next 6 months, once we'd completed all the cleaning, is the hospitals that done a thorough but quick job, um, that didn't take all of the measures that those that took a bit longer took. Their numbers of bacteremia started after an initial significant drop to to increase again, to the extent that a number had to repeat the deep clean. Whereas those of us that have taken our time, much on occasions to some disapproval from top of the office, found that the level of bacteremia is reduced, and we found ways of continuing to reduce it. Obviously, this is in association with hand hygiene and a whole set of other practices as well. But it did reinforce not seeking short-term answers to long-term questions, and one also has to apply that with some external management to reassure or assure the top of the office that we are going after the objective. But the next is there is real magic in the pursuit of bold, audacious objectives in service of others. And the example that taught me this was an idea that a fabulous consultant neurologist and ward sister Paul Mellack and Sue Reed in Leicester Infirmary came up with, and that was to transform the outpatient experience of a neurology patient once referred by their GP. And typically, that sort of referral would require the patient to visit the hospital 3 or 4 times in order to go through the battery of tests. And the fourth or the final visit would be to see the consultant and his or her team in order to agree the diagnosis and the management plan and so on and so forth, where that was possible. And Paul and Sue came up with the idea of, well, let's do it in a single visit. It was actually based on a model in the Mayo Clinic in the States. And again, long story short, through a good deal of good fortune, we were able to institute this clinic in 5 weeks. All the setup took 5 weeks. And then once we'd run the clinic, the feedback from patients and their loved ones was fabulous. And we did it against a baseline measurement of the pre-existing clinic arrangements. The patients and their loved ones said it was fabulously valuable for them to have what are often very troubling symptoms, wherever possible, explained by the clinical team in one visit. They didn't have to park, they didn't have to make arrangements for kids, they didn't have to have time off work, and so on and so forth. The staff really appreciated it because they could bond with the patients and see the whole experience up until the diagnosis and treatment plan. The students loved it because of the same reason, and we didn't lose medical records. And it also saved a significant amount of money. There were no ambulance trips, or only one ambulance trip, or a couple of trips there and back are required, and so on and so forth. And we then applied that approach to many outpatient clinics and elsewhere. So being really bold and not improving things by 2 or 3%, but going after 50, 60%, because that forces us to think differently and to de-anesthetize our view of the familiar. And in staff engagement, Professor Michael West has demonstrated the causative, not just correlative, but the causative link between high quality teamwork and high quality staff engagement and clinical outcomes. Groundbreaking research. Do check him out if you're so interested. He's based in the UK. He's done a lot of work with the King's Fund, focusing on the UK health systems. He's worked in a number of the devolved administrations. But staff engagement is a hugely important metric, and within Defence Medical Services, we are doing our very best to support staff so they feel the strongest possible sense of empowerment, support, appropriately challenged, but also appropriately enabled. And our ambition is to make the Defence Medical Services the best place in the MOD to work. And this is it's a journey. It's not an event, but that's what we're going after. And of course, trust is vital as a leader, and it can't be manufactured like instant coffee. It's often formed, as you will well know, in settings of significant adversity and challenge. And the way in which we behave, particularly in those highly stressed environments, is noted by others and is regarded as an example of leadership and the style of leadership that is seen to be acceptable. and it's part of our leadership signatures. And individuals have stories about their leaders, I'm sure, including your good selves. I have names attached to you. Most, I'm sure, will be polite, but as a leader, you're never off show. Whether it's in the operating theatre, the outpatient theatre, the GP clinic, on a mission, operations in the supermarket, you're always on show. And authenticity, you can't fake it. It's no good trying to be someone you're not. And then the notion of learning about other experience. So invite people to your gemba, which is a Japanese phrase for where value is created. It could be the payroll, it could be the clinic, theatre, the lab, the physio gym, and wherever the gemba is. And certainly, if you would like to find out what the Director General of the Defence Medical Services does, drop me an email and let me know, and you'll be welcome to spend some time with me. But make sure your boss is happy with this. The only thing I ask is that I reciprocate and spend some time with you. We all have the same objective within Defence Medical Services, and indeed across the MOD. We just have different contributions. The next is something that I learnt through a number of clinical disasters and organizational disasters. And as a chief exec, one is rightly responsible and accountable when things go wrong. And that is, when things do go wrong, always ensure that the impact of the learning from what has gone wrong is far, far, far greater than the impact of what went wrong. And sometimes that can be really difficult. In my career, I was responsible for a radiotherapy service where the LINAC had been inappropriately calibrated and led to severe harm of very many patients. And seeking to correct that as quickly as we could. In some cases, the harm was irreversible. I'll never forget the conversations with both the patients and the next of kin, and indeed the staff, the secondary victims of these disasters. But we sought to take action whereby this would never, ever be possible again, and we share that across the health service as well. But I really do commend that view of when something goes wrong, dealing with, of course, immediately, and then taking whatever action one can in order to avoid, if it's possible, a repetition, but certainly reduce the risk, but making sure that the impact of the learning is far greater than the impact of what went wrong. Warren Bennis, no longer with us, an American author on leadership, has got some great work, which I would commend to you. And then linked to when things go wrong, the other aspect is to look at a situation when a difficulty first presents itself. And something that I try to do is when considering with a team or myself what one's going to do about something, a challenge, manage today as a necessary past condition for the future that you want to create. In other words, make sure that if we put ourselves 5 years forward from whatever it is that's happened, and then we look back, that and the service that we provide to those we serve is that we draw from the experience that has occurred in a way that improves what we do, how we do it for those we serve as well as for staff. And the next, of course, as I hope you know, you are a powerful role model. As we've commented already, you're never off duty, but how you conduct yourself, and indeed what people's experience of you is like. What's it like to be on the receiving end of you? Do individuals come away feeling energized, inspired, or is it a different experience? And the benefits, as I've had recently, of 360-degree feedback and increasingly 180-degree feedback is enormously powerful, and sometimes can cause some discomfort, but there's a really, I think, a positive correlation between the degree of discomfort, providing one accepts it with an open mind, and the degree of growth and opportunity. And then cubic centimeters of chance. Yosef is fabulous sage, modern day sage. Check him out on Twitter. He's training to become a healthcare assistant. Was previously a porter in Royal London. He's probably the only porter that's published an article in the British Geriatric Society journal called The All-Seeing Hospital Porter. And what he describes there is the myriad of opportunities as a porter to help others, patients, their loved ones, visitors, staff, whether it's providing directions or a smile or some other expression of empathy. Joseph Jaworski on My Desert Island Risks reads, calls these moments cubic centimeters of chance. I imagine you've had some over the last 24 hours, i.e. an opportunity to express interest, support for others, or not. Did you take those cubic centimeters of chance? And if one harvests those wisely and thoughtfully during the course of one's life, you'll change the world more than you ever know. The beneficiaries most likely will never forget, whilst you probably will forget each of the cubic centimeters of chance. And I think leaders have an obligation to be leaders in openness and transparency. And of course, the value of genuine constructive criticism to ensure that the notion of we are all work in progress in order to be the best version of us that we can be. And then finally, when looking at one's objectives, and I've recently completed drawing up my objectives for General Patrick's a fabulous boss. And what I've tried to do is include in my personal development plan activities and work to nourish mind, body, and soul. And too many times in my career, when looking back across my lifeline, I've neglected to do that. So I offer that to you, hoping it will be some help. People who think they won't achieve much rarely do. People who think they will achieve much rarely don't. Richard Wilkins. And my desert island reads, I particularly recommend here Jaworski, Synchronicity, which is a really fascinating leadership story. Malcolm Gladwell writes fabulously with enormous insight into whatever his subject is. And then Matthew Said, Black Box Thinking, which includes in the opening chapter the description of the loss through essentially a very straightforward, should have been straightforward ENT procedure of the wife of an individual. And that individual happened to be a pilot and then worked with the clinical team that operated on the patient that died and deconstructed events to find out what went wrong, not simply who went wrong. And then that individual is now one of the leaders of the human factors movement across the country and internationally in terms of the application of that human factors thinking to healthcare. And that, ladies and gentlemen, is the end of my contribution. And if I could say, I hope your own leadership journeys are as interesting and appropriately challenging in a way that enables you to be the best version you can be. And if you think there's anything else we at the Defence Medical Services can do to support you, then we're here to do that. Go boldly, go well. Thank you.